So, shall we start? Okay. So, good evening, all. The topic of today's discussion is about the meninges, that's the dura mater, arachnoid matter, pia mater, its prolongations, spaces, and CSF. In the previous sessions, we have studied about the spinal cord in detail. Now, we are going to learn about the brain. Okay, brain, that's mainly its coverings, that's meninges, and see about the CSF. So, brain is very important, delicate organ. That's a part of CNS. That's a central nervous system that involves the brain and the spinal cord. And it is protected by three coverings mainly. And outermost, that is the bony covering of the cranium is also protecting the brain. And beneath that, we can see the coverings of the brain. That is the dura mater, arachnoid matter, and the pia mater. Okay, these are the membranous covering of the brain. So, outer dura mater is always called pachymeninx, and the middle arachnoid matter and the inner pia mater. And the arachnoid and pia mater, they are together known as the leptomeninges. So, arachnoid and pia together known as leptomeninges. And usually the cerebrospinal fluid or the CSF, it fills the space between the arachnoid and the pia maters. That's what we call as the subarachnoid space. That is outside the brain and inside the cranial cavity. The CSF is located in the subarachnoid space, that is between the arachnoid and the pia maters. And usually what's the main function of CSF is to act as a cushion or the protective effect for the brain is provided by the CSF. So usually our brain is about 1500 grams. That's the weight of the brain. But with the help of CSF, the weight of the brain can be reduced. I.e., the weight we feel can be reduced by the help of CSF because of the buoyancy of the fluid or the cerebrospinal fluid. The weight of the brain that is felt by the human being is less. Okay. And the outermost meninx, that's a dura mater, not only separates the right and left cerebral hemispheres, but also it partitions the cerebrum from cerebellum and hypophysis cerebri. That's by the formation of different dural folds. Okay. And in addition, it encloses various venous sinuses also. Venous sinuses are also present between the two layers of the dura mater. The dura mater is having two layers, an outer endosteal layer and an inner meningeal layer. And in between the endosteal and the meningeal layer, we can see the venous sinuses. And CSF forms the watery cushions around the blood vessels also. Blood vessels to give them a shock-free environment. So, the blood vessels which are coming out of the brain and entering the brain, they are protected by a layer of pia mater. Okay, a covering of pia mater will be there for the blood vessels and nerves also. Okay, so the first meninges, that's the outermost covering of the brain, is the dura mater. And it is made up of basically two layers are there. An outer endosteal layer that's in intimate relationship with the cranial cavity, innermost part of the cranial cavity, and an inner meningeal layer that is enclosing the cranial venous sinuses between the two. That is, the cranial venous sinuses are seen in between the outer endosteal and the inner meningeal layers. Okay, and the meningeal layer forms four folds which divide the cranial cavity into intercommunicating compartments for the different parts of the brain. Okay. So, these are the different folds of the dura mater. Okay, the inner fold, that is outermost part is the endosteal layer, which is seen associated with the cranial cavity, and the innermost part, that is a meningeal layer, will be fitting into the grooves of the substance of the brain, leading to different folds and divisions. Okay, first fold is the false cerebri. In the superior part, between the two cerebral hemispheres, there is an infolding of the dura mater forming the false cerebri. Okay, and here we can see the superior sagittal sinus, and here we can see the inferior sagittal sinus. And these two are this is the outermost layer of the dura mater and the innermost layer. Innermost layer is undergoing the folding. Okay, in between these two layers, there is no space normally, but in the at the site of the dural sinuses, we have a. At the site of the dural sinuses, we have a potential space that is enclosing the sinuses. Okay, this is more posterior. These are all coronal sections of the brain, sorry, the cranial cavity, and this is moving more posteriorly. Okay, so we can find another structures also, different structures, different sinuses, etc. Okay, now this is the side view. Okay, so a 10-like shape is seen for the false cerebri, and this is what we call as, this false cerebri is separating the two cerebral hemispheres, and this is the top view of the tentorium cerebelli, that is separating the cerebellum and the cerebrum. Okay, and also there is a fold that is separating the two cerebellar lobes also. That is what we call as false cerebelli. Okay, so false cerebri is sickle shaped. This is a sickle shaped fold of the dura mater which separates the right and left hemispheres, cerebral hemispheres. And superiorly, it has a convex margin. Okay, this is a convex margin, and inferiorly, we have a free concave margin. And usually, the superior convex margins, they are attached to the sides of the groove, lodging the superior sagittal sinus. That's in the cranial cavity, no? The superior part is attached to the sides of the groove, that is lodging the, here we can see the superior sagittal sinus. And inferiorly, we can see a concave margin, that's free. Okay, that's not attached to anywhere, that is free. And the anterior attachment is here. There is a landmark called crista galli in the bone, and this part is attached to that crista galli. And posterior to the, this part is attached to the tentorium cerebelli. This is the tentorium cerebelli. That is the transverse view, transverse section of the cranial cavity. We can see the tentorium cerebelli like this. Okay, and the posterior part of the false cerebri is attached to the upper surface of the tentorium cerebelli, which is separating the cerebral hemispheres. Not cerebral hemispheres, the cerebrum, that is the cerebral hemispheres and the cerebellum. Okay, that is separated by the tentorium cerebelli. And the tentorium cerebelli, it separates the cranial cavity into two, a supratentorial portion above the tentorium cerebelli, and beneath the tentorium cerebelli, that's the infratentorial portion. Okay, thus we can divide into two parts by means of the tentorium cerebelli. And the tentorium cerebelli, it's a 10-shaped structure which separates the cerebral hemispheres from the hindbrain and the lower part of the midbrain. And it also lifts off the weight of the occipital lobes from the cerebellum. And it has an anterior free margin. This margin is free. It is attached to the, this portion is attached to the anterior clinoid process, and rest part of this free as well as they are concave. Okay. And the posterior margin, it is attached to the lips of the groove containing, here we can see the transverse sinus. This is the transverse sinus. Here we can see the transverse sinus and superior petrosal sinus and to the posterior clinoid processes. And the venous sinuses which are enclosed by the tentorium cerebelli are transverse sinuses and superior petrosal sinuses. Okay. And next is the false cerebelli. As the name indicates, it's also a sickle-shaped fold, partly separating the two cerebellar hemispheres. And here, the base is attached to the posterior part of the inferior surface of the tentorium cerebelli, and apex reaches till the foramen magnum. And it encloses the occipital sinuses. And next is the diaphragma sellae. That is a small horizontal fold that is located near the pituitary. Okay. And the anterior attachment is to the tuberculum sellae, and the posterior attachment is to the dorsum sellae. And laterally, it is continuous with the dura mater of the middle cranial fossa. And it encloses the anterior and posterior intercavernous sinuses. Okay. So that's all about the dural folds. Now coming to the second meningeal layer, that is the arachnoid matter. The term arachnoid means it is like a cobweb. Okay, that's the spider's web. And matter means it is matter means mother. Okay. So arachnoid matter is a thin transparent membrane that loosely surrounds the brain without dipping into its sulci. That is loosely covering, not dipping into every folds and fissures of the brain. It is loosely covering the brain. And so it bridges all the irregularities of the, it is not containing into the different irregularities, and hence it bridges all the irregularities of the brain. And but in some areas, it enters certain sulcus and fissures That is the stem of the lateral sulcus where it is pushed by the lesser wing of the sphenoid, and the longitudinal cerebral fissure where it is carried by the falx cerebri. And it cannot be identified in the hypophyseal or pituitary fossa. Okay. So, what are the relations of arachnoid matter? It is separated from the dura by the, so the dura and arachnoid is separated by the subarachnoid space, and from the pia, that is the innermost membrane, by the subarachnoid space containing the cerebrospinal fluid. Sorry, from the dura by the subdural space. Okay, between dura and arachnoid we have the subdural space, and between the pia and the arachnoid we have the cerebrospinal fluid and the blood vessels. So cerebrospinal fluid outside the brain is located in the subarachnoid space. Okay. So what are the prolongations? Prolongations of the arachnoid matter. We know that pia matter will be covering the blood vessels that is coming outside the brain and inside the cranial cavity. The blood vessels and nerves, everything is covered by the pia matter. Like that, it provides the sheets for the cranial nerves as far as its exit from the skull. Before the exit of the cranial nerves from the skull, it is surrounded by the pia matter as well as the arachnoid matter. And there are structures called arachnoid villi. Arachnoid villi, they are finger-like processes of the arachnoid tissue projecting into the cranial venous sinuses. We have already studied the cranial venous sinuses. Okay, that is situated between the two parts of the dura mater. That is the endosteal layer and the meningeal layer. Okay, we can see the cranial venous sinuses, and they have certain openings which contain infoldings of the arachnoid matter. That is what we call as finger-like projections of arachnoid matter is seen inside the cranial sinuses, cranial venous sinuses. What's the purpose of this arachnoid villi? It is important for the absorption or the drainage of the CSF. CSF is like the lymph. Okay, lymph in other parts of the body is similar function with the CSF. In CNS, we have the CSF. In body other parts, we have the lymphatic system. Like the lymph, this CSF is draining into the venous sinuses by means of the arachnoid villi. Okay. When the person gets aged, what happens is that this arachnoid villi gets enlarged in size to form pedunculated tufts. They are called arachnoid granulations. Okay. So arachnoid villi we cannot see by our naked eyes, but we can see arachnoid granulations with our naked eyes because numerous arachnoid villi will enlarge to form pedunculated tufts, and they are called arachnoid granulations. What's the purpose of this arachnoid villi? It's the absorption of the CNS and the drainage of CNS. And these granulations may sometimes produce depressions in the bone also. Okay. So here we can see the superior sagittal sinus. The main part we can see the arachnoid granulations or the arachnoid villi is the superior sagittal sinus. Here we can see small openings which are for the arachnoid granulation and the arachnoid villi. So extension of the arachnoid matter into will be like finger-like projections which extends into the superior sagittal sinus as arachnoid villi, and together when with the advancing age, what happens is numerous arachnoid villi will be coalescing to form arachnoid granulations. This main purpose is to absorb the CNS. Okay, next layer or the innermost meningeal layer is the pia mater or the pia mater. So pia mater in Latin, it means loving mother or very soft. Pia means something that's very soft. Matter which is a thin vascular membrane which closely invests the brain and dipping into various sulci and other irregularities of its surface. Unlike the arachnoid matter, this pia matter will be entering or dipping into various sulci and other irregularities. The function of the arachnoid was to bridge all the irregularities, but here this pia matter is in close relationship or intimate relationship with the brain. Okay. And basically the pia mater, it consists of the epipia and the pia glaya. And on the cerebellum, this pia mater dips and forms folds in relation to larger fissures of the cerebellum. Okay, larger fissure, it will be dipping and forming folds in relation to the larger fissures of the cerebellum. Okay. And now coming to the prolongations of the pia mater. We have already learned some of the prolongations of the pia mater in relation to the spinal cord. Here in brain also there are certain prolongations. Okay, so it usually provides sheets for the cranial nerves merging with the epineurium around them. We have the cranial nerves. And above the cranial nerves, the outer covering is called the epineurium. Okay, the outer covering is the epineurium, and each fascicle is covered by the perineurium. And each nerve fiber is covered by the endoneurium. Okay, so this pia mater will be covering the cranial nerves inside the cranial cavity. Till its exit, it is covered by the pia mater. It is merging or blending with the epineurium around the cranial nerves. And also it provides a perivascular sheath, so the minute vessels. For the blood vessels, it also provides a perivascular. Perivascular means something that is surrounding the blood vessels, so the minute vessels that are entering and leaving the brain substance. And also the folds of pia mater, which encloses a tufts of capillaries from the tela choroidea. Okay, so we have the, for the formation of CSF, we have the choroid plexus. So what is basically choroid plexus? We have the choroid arteries, which is entering the cavities. We have different cavities containing CSF inside the brain substance. I.e., in the lateral ventricles are seen within the cerebral hemispheres. There are two lateral ventricles, and together they form the third ventricle, and after that we have the cerebral aqueduct, and after that we have the fourth ventricle, and its prolongation will be in the central canal via the central canal of the spinal cord. Okay, that will be learning in the next slides. Okay, so what is choroid plexus? Choroid plexus is a structure that's responsible for the formation of CSF. Then what is tela choroidea then? So we have the choroidal arteries which are entering the inside the cavities of the brain, and inside the cavities of the ventricles of the brain, what happens is this choroidal arteries will be forming capillary loops, specialized capillary loops, and after that, this forming the capillary loops, they will be draining outside the outside via the choroidal veins. Okay, and this capillaries enclosing choroidal capillary tufts, which are specialized, are covered by the pia mater. Okay, and this capillary tufts that is covered by the pia mater is called tela choroidea. And again, this pia mater is again lined by secretory ependymal cells. Okay, this secretory cells are called ependymal cells, and this pia mater is again lined by ependymal cells, and this forms the choroidal plexus. Okay, this choroid plexus is responsible for the formation of CSF. Okay, there are certain pumps which are actively supplying sodium into the this capillaries, inside the capillaries, especially cells which carry the sodium, and along with sodium, water chloride ions also enter inside the secreting area. Okay, this will draw the water towards the secreting area, and also some amount of potassium will be pumped out of the cell. Okay, producing cell pumps out the potassium, but sodium and chloride is pumped inside to form the CSF. Water also is drawn along with the sodium and chloride. Okay. Again, one point is there. This glucose concentrating system is not as good. So the amount of glucose present in the plasma is always more than what is present in the CSF. I.e., CSF when compared to the plasma, glucose levels in the CSF is lesser. That is about 60% lesser than the glucose that is contained in the blood or the plasma. Okay. So now coming to different spaces. What is extradural or epidural spaces and what is subdural spaces? In spinal cord, we have learned that there is no endosteal layer, and hence there is a true space. That is what we call called as epidural space in the spinal cord. Okay. Whereas in brain, there is no true space, only potential space is there. So what is epidural space in a brain? That is, it's a potential space between the inner aspect of the skull bone and the endosteal layer of the dura mater. Okay, we know that there is an endosteal and meningeal layer for the dura mater, and between the endosteal and the inner aspect of the skull bone, we can see the extradural space. That is not a true space, but it's a potential space. Potential space means what? That is seen opening up only in some certain pathologies, not in normal cases it is not seen, but in certain pathologies like space occupying lesions, etc., or tumors, in conditions like that, we can see a space between this inner aspect of the skull bone and the endosteal layer of the dura mater. Okay. And this subdural space that is seen between the dura and the arachnoid mater. Okay. So it is traversed by different cerebral veins on their pathway for draining into dural venous sinuses. So you have heard about the extradural hemorrhage. When there is a trauma to the temple, usually this is seen associated with the temple region, okay, or the temporal region. When a sudden or violent blow is happening to the temple region, what happens is the middle meningeal artery will be getting injured, and that will lead to hemorrhage in that particular area. Okay, here we can see this dura mater is very tightly adherent to the sutures. Okay, so a lens-shaped hemorrhage will be formed in relation to this temporal area. This mainly it is caused by the injury to the middle meningeal artery. Okay, middle meningeal vessels. So there is a term that is called lucid interval. The patient will be initially after the injury, the patient may be conscious and responding normally. But after some time, what happens is that patient may lose his consciousness. Why? Because of the progressing hemorrhage in the extradural area. That will be compressing the brain, that will lead to symptoms. That normal part that is occurring between the time of injury and the occurrence of the symptoms, that is what we call as lucid interval. That's very important. And here the treatment is simple. By making a burr hole and draining and evacuating the hematoma, the patient can be treated. But it has to be found early enough, okay, for the patient to survive as well as to prevent any unwanted consequence. We have to find this type of injury. But this is somewhat easier because after the injury, we can take a CT and we can see a lens-shaped hemorrhage occurring in the extradural part. Okay, extradural space. We can see in CT, we can see a lens-shaped hematoma forming. And another type of hemorrhage is called subdural hemorrhage. That is due to the injury to the bridging veins. Usually, the subdural hemorrhage is occurring and extradural hemorrhage is usually well localized. Between the sutures, we can see this extradural hemorrhage. It will be having more compressing effect. Okay, because of the localized positioning of this type of hemorrhage. And subdural is between the dura and the arachnoid matter. So it is not well localized as when compared to the extradural hemorrhage. It is not well localized. It's somewhat diffuse when compared to the extradural. It is due to the injury to the bridging veins that is seen in the subdural space. Okay. Bridging veins are responsible for the subdural hemorrhage. And next type of hemorrhage which is seen in the subarachnoid space is caused by the damage to the circle of Willis. That is the main vessel system that is supplying the central nervous system or the brain, supplied mainly by the circle of Willis. There are certain aneurysms. Aneurysms are abnormal dilatations in the wall of the veins, usually seen in hypertensive patients. Okay. Some berry aneurysm may be breaking in the subarachnoid space. And how we can diagnose? We can see blood or RBCs in the CSF, which is taken via the lumbar puncture. Okay. So that's all about extradural, subdural and this subarachnoid hemorrhages. So what is subarachnoid space? This is the space between the arachnoid and the pia mater. And it is traversed by the network of arachnoid trabeculae, which give it a sponge-like appearance, and it surrounds the brain and spinal cord and ends below the lower border of the second sacral vertebra. That is, the spinal cord will be ending up, it will be reaching only up to the L2 vertebrae, whereas in this arachnoid will be reaching up to the second sacral vertebra. And the subarachnoid space, it contains the CSF, large vessels of the brain, and the cranial nerves pass through this particular space. And large arteries which lie in the subarachnoid space and smaller vessels, they carry the sheath of pia along with this. Okay. And subarachnoid space and perivascular space, they are also separated by a layer of pia mater. Now coming to what we call as cisterns. What are cisterns? They are simply dilatations of the subarachnoid space in certain regions. Okay. At the base of the brain and surrounding the brainstem, the subarachnoid space forms the intercommunicating pools, which are called cisterns. So they reinforce the protective effect of the CNS on the vital centers. Vital centers of the brain are mainly located in the pons, medulla, etc. Okay. Medulla oblongata is a very important vital center because respiration, everything is controlled by that particular part of the brainstem. Okay. So, in order to reinforce the protective effect of the CSF on the vital centers, we are having the cisterns. And these are the main subarachnoid cisterns. First is the cerebellomedullary cistern or the cisterna magna. It's the largest cistern lying in the angle between the medulla oblongata, cerebellum and the occipital bone. So here we can see the cerebellomedullary cistern. Here we can see the cerebellomedullary cistern. This is a triangular shaped area. Survey is called cisterna magna. Okay, it is lying in between the angle between the medulla. Here we can, this is the pons, this is the medulla oblongata. Medulla oblongata, this is the cerebellum, and here we can see the occipital bone. Here, this is the cerebellomedullary cistern or the cisterna magna, largest cistern. Okay, here we can see this is the fourth ventricle. Okay, so it's a triangular section and it bridges the interval between the inferior surface of the cerebellum and the medulla oblongata. Okay, this is the inferior surface of the cerebellum. It bridges the inferior surface of the cerebellum as well as the medulla oblongata, and it communicates with the three openings. Here we can see that this is the fourth ventricle, a tent-shaped structure. This is the fourth ventricle. It is having three openings in its roof. One is the two are the lateral openings, which are called foramen Lashka, and one posterior median opening, which is called foramen Magendie. Okay, so this cerebellomedullary cistern communicates with these three openings of the fourth ventricle, and along with that, it also communicates with the posterior part of this. This is the posterior part of the subarachnoid space. Okay, and another cistern is the cisterna pondus. It is present on the ventral aspect of the pons. That is, this is the ventral aspect of the pons. This is the pons and this is the ventral aspect. This is that's the anterior aspect is always called ventral aspect and posterior is always called dorsal aspect. So cisterna pondus is seen in the front of pons or the ventral aspect of the pons, and it is basically contained in the basilar artery. So vertebral arteries together they form the basilar artery and its branches, and it is continuous with the, here we can see the interpeduncular cistern. Okay, here we can see the interpeduncle. Between the peduncles there is a cistern, that is what we call as interpeduncular cistern. Cranially, that is above, we can see it is continuous with this cisterna pondus is continuous with the interpeduncular cistern and with the cerebellomedullary cistern. Behind, we can see the cerebellomedullary cistern and with the spinal subarachnoid space caudally. That is below, we can see the it is continuous with the spinal subarachnoid space also. And another cistern is the interpeduncular cistern. Here we can see that between the peduncles, we can see the interpeduncular cistern. Okay. It is containing the important circle of Willis. That's the main blood supply of the brain is by the circle of Willis. That we will be learning in the later coming sections, upcoming sections. Okay. Another one is the cistern of lateral sulcus, and cistern of great cerebral vein is also there. That's always called cisterna ambiens. And this cistern, this lumbar cistern is important because it's the largest subarachnoid space in the lumbar region of the vertebral column. It is distal to the termination of the spinal cord. The spinal cord is terminating in the L2 region. And so we are doing the lumbar puncture or taking the CSF is usually done in the space between the L3 and L4 vertebrae, which is a part of lumbar cistern. Here we can do the lumbar puncture to obtain the sample of CSF. So the arterial pulsations within the cisterns help to force the CSF from the cisterns onto the superolateral. So in order to pump the CSF to every part of the brain, this arterial pulsations within the cisterns will be helping. Okay, and the cisterns themselves from, so we know that there are important centers, vital centers in the medulla oblongata. They are cushioned by the cisterns because these are dilatations which is containing more amount of CSF when compared to the other parts of the subarachnoid area. Okay, so in order to provide more protective functions, we are having this cisterns. Now coming to the communications. So this subarachnoid space communicates with the ventricular system. We are having the subarachnoid space outside the brain which is containing the CSF, and inside the brain also there are areas which is having the CSF, that is mainly the ventricles. Okay, so it communicates with the ventricular. The outside CSF and the internal CSF is communicating via a median foramen of Magendie, which is seen in the median aspect of the fourth ventricle. posterior aspect, we can see the foramen of Meninges. That is a single opening. That also communicates with the outside subarachnoid space, and also two lateral foramina. That are the lateral openings of the fourth ventricle. That is called foramen of Luschka, situated in the roof of the fourth ventricle. Here the CSF passes through this foramina from the fourth ventricle to the subarachnoid space. So the traversing of the different parts of the brain are covered by, are coordinated by means of this provided nutrition, etc., by means of this CSF continuation. Okay, so inside and outside CSF is contacting by means of this lateral foramina of Luschka as well as the foramina of Meninges, which are present in the roof of the fourth ventricle. Okay, now coming to the prolongations. The space is prolonged into this particular space, that is a subarachnoid space, that is prolonged into the arachnoid sheets around the nerves. We have the nerves surrounding that, we have a layer of pia, and outside to the pia mater, we have this arachnoid sheet, and this prolongation of the subarachnoid space is seen around the nerves. It communicates with the neural lymphatics, particularly around the first nerve, first, second, and eighth cranial nerves. Okay, so the subarachnoid space prolongations is seen associated with the first, second, and the eighth cranial nerves. Okay, that is first is the olfactory, optic, and eighth, that is vestibulocochlear nerves. They are having a prolongation of the subarachnoid space surrounding the this vein, nerves. And the space also extends into the pile sheets around the vessels, that is entry. We know that these vessels, the perivascular space is covered by pia mater, and the subarachnoid space is extending into that particular pile sheets also. So, thereby this CSF in the subarachnoid matter is in contact with the direct contact with the nerve cells, thereby providing nutrition. Okay, there are some clinical importance that we will be coming into in next slides. Okay, now coming to the cerebrospinal fluid. So it is basically a modified tissue fluid, and it is contained in the ventricular system, that is involving the lateral ventricles. Then by means of foramen Monro, it is draining into the third ventricle, and after that by the cerebral aqueduct. Via the cerebral aqueduct, it is connected to the fourth ventricle, and fourth ventricle continues as the central canal of the spinal cord. Okay, so CSF generally replaces, it's similar to the lymph. Okay, so CSF replaces lymph in the CNS. And what is the formation? Formation of the CSF, it is by means of choroidal plexus. Choroid plexus is the capillary loops that are entering the brain substance. That is, choroid arteries are choroidal artery that is entering the blood, the cavities of the brain will be forming specialized capillary loops which are surrounded by the pia mater, and above that we have the ependymal cells. This together forms the choroidal plexus, which produces the CSF. So the bulk of CSF is formed by the choroidal plexus of the lateral ventricles and lesser. Mainly this choroid plexus is located in the lateral ventricle, and some amount is present in the third and fourth. Mainly it is in the lateral ventricle. Lateral ventricle is the cavities present between the inside the two cerebral hemispheres. So there are two lateral ventricles. And possibly it is also formed by the capillaries on the surface of the brain and spinal cord. Some amount is formed by the capillaries on the surface of the spinal cord. The total quantity is about 150 ml, and it is formed at a rate of about 200 ml per hour or 5000 ml per day. Okay, and the normal pressure of CSF is about 60 to 100 millimeter of water. So, coming to the circulation of the CSF. CSF passes from each lateral ventricle. We have inside the each cerebral hemisphere, there is a lateral ventricle. So, there are two lateral ventricles, and it will be draining into the third ventricle through the interventricular foramen of Monro. So, lateral ventricle is having foramen of Monro. Each lateral ventricle is having foramen of Monro. Okay. And from there, the CSF is draining into the third ventricle. That is present above the thalamus. Okay, in the midbrain, above the thalamus, we can see the third ventricle. It passes through from the third ventricle, it passes through the fourth ventricle, which is situated somewhat caudally, through the cerebral aqueduct or the aqueduct of Sylvius. And from the fourth ventricle, the CSF passes through the subarachnoid space of the cerebrum, And the vertebral canal through the median and lateral apertures. We have already studied there is a medial aperture called foramen magendi and lateral apertures which are called foramen luschka. By these three apertures, this inside CSF is communicating with the outside CSF which is present in the subarachnoid space. And some of it passes down through the central canal of the spinal cord. And at the termination of the spinal cord, we have the terminal ventricle. Okay. So this is the lateral ventricle. Okay, there is a frontal extension is there. Two temporal extensions are there. One temporal extension is there for each ventricle. We have a temporal extension. There is a frontal extension. Okay. So these are the lateral ventricles. They are having the foramen of Monro, and that will be draining into the third ventricle. This is the third ventricle, and via the aqueduct of Sylvius, it is coming to the fourth ventricle. Here we can see the fourth ventricle. Okay, and after that we have the central canal which is seen inside the spinal cord. Okay, so this image, it will be more clear. This is the lateral. These are the lateral ventricles. Okay, and these are the interventricular foramen which is connecting with the third ventricle. From here, the CSF is draining into the third ventricle which is situated above the thalamus. And here we can see this is the aqueduct. Okay, cerebral aqueduct or the aqueduct of Sylvius. And from this third ventricle, via the aqueduct, cerebral aqueduct, it is reaching, this is the fourth ventricle. This is the coronal section. Okay, this is the coronal section of the brain. And this is the fourth ventricle, and its continuation is the central canal of the spinal cord. This is basically the structure of the ventricle and the drainage of the CSF. Okay. So this is the inferior horn. Okay. Lateral ventricles to the third ventricle via the foramen of Monro, and this is the cerebral aqueduct from there to the fourth ventricle. These are the lateral openings which are called foramen luschka, and there is a median opening that is called foramen magendi. Via these three openings, this inside CSF is communicating with the outside CSF present in the subarachnoid space. Okay, now coming to the absorption. So CSF is absorbed chiefly through we have already studied, there are arachnoid villi, which are the extensions of the arachnoid matter into the dural sinuses. Okay, they are forming small finger-like projections which are called arachnoid villi, and advancing with the advancing age, this villi coalesce to form granulations, and this is drained into the cranial venous sinuses. Okay. It is also absorbed partly by the perineural lymphatics around the first, second, and eighth cranial nerves. And so we have studied that the subarachnoid extensions is seen around the first, second, and eighth cranial nerves. Okay, so it is also absorbed partly by the perineural lymphatics that is located around the first, second, and eighth cranial nerves. It's also absorbed by the veins which are related to the spinal nerves also. That's about the absorption of the CSF. And now coming to the functions of CSF. What's the main function of CSF? That is the protective function. CSF, which forms as a cushion around the brain, which is protecting it from minor injuries. And CSF decreases the sudden pressure or forces on delicate nervous tissue. Also, it reduces the weight of the brain that is felt to the human body. And also, nourishment function is also for the CSF. Only CSF is coming. We have already mentioned that CSF is coming into contact with direct contact with the neurons, thereby nourishing them. Even blood cannot directly come in contact with the neurons, but CSF can, and hence it provides nourishment and returns the products of metabolism to the venous sinuses. Okay, nourishment as well as drainage or metabolic wastes are also carried out by the CSF. So they are formed mainly in the lateral ventricles. Main formation of CSF is taking place in the lateral ventricles, and some amount is formed in the third and fourth ventricles also. This lateral ventricles CSF forms via the interventricular foramen or the foramen Monro. It is reaching the third ventricle, and From the third ventricle to fourth ventricle, there are aqueduct or cerebral aqueduct or aqueduct of Sylvius, whatever it is. It is coming to the fourth ventricle, and from fourth ventricle, it can either it can move to the central canal of the spinal cord, or via the three apertures on the roof, that is the foramen magenti as well as foramen luschka, that is seen laterally. They can open into the either into the cerebromedullary cistern and pontine cistern, i.e. the subarachnoid spaces which are present in the cranial cavity. Also, it can open into the subarachnoid spaces around the spinal cord and the chorda equina, and it can reach the veins of spinal cord, and thereby it can drain. Okay, or it can continue via the cerebellomedullary cistern and pontine cistern, i.e. the subarachnoid spaces which are located in the cranial cavity itself, and thereby reaching the tentorial notch, the inferior surface of the cerebrum, and then to the superolateral surface of the cerebrum, and via the arachnoid granulations, it is absorbed inside the superior sagittal sinus. So this is a pathway of the CSF. Okay. Now, another function of this CSF is that the neurons cannot live without glucose. Neurons are essential part of the central nervous system, and they cannot live without glucose and oxygen for more than 3 to 5 minutes. That's why some cerebral ischemia can lead to far-reaching wide consequences when treated early enough. When not treated early enough, this it can lead to permanent impairment of the nervous system, because neurons cannot live without glucose and oxygen for more than 3 to 5 minutes. And they are constantly provided by the CSF. And pineal gland secretions also reach the pituitary. Pineal gland means the day-night balance, etc. is carried by the pineal gland, and their secretions reach the pituitary gland via the CSF. And a major function of CSF is to cushion the brain within its solid vault, and the brain and CSF, they have approximately the same specific gravity. So brain simply floats in the fluid, and hence the total weight of the brain is much reduced. Okay. And there is no CSF brain barrier, i.e. CSF can reach the brain without any barrier. So drugs that are contained in the CSF can reach the brain without any delay. Okay. So drugs can reach the neurons via the CSF, but there is a blood CSF barrier. What's the clinical importance? There is a blood CSF barrier, and hence antibodies that are present in the blood or the plasma cannot be reaching the CNS. And hence the infections of the brain are very serious, because there is a blood CSF barrier, and hence antibodies present in the blood will not reach the CSF, making the infections of the brain very serious. Okay. So that's in brief about the meninges CSF, the formation, the absorption, and the drainage. Okay. So this is a very short topic and very important. Okay. So that's all about the meninges and CSF. Thank you for the patient listening.